Welcome to today's OET speaking practice. In this role play, you'll see how to explain anemia to a patient in a clear and reassuring way. Watch closely for effective communication techniques and don't forget to take notes. Let's begin. Hello, Miss Patient's name. Your test results show that you have anemia, which means your body isn't getting enough oxygen due to a low red blood cell count. This explains your shortness of breath and rapid heart rate. If left untreated, it could lead to serious issues like heart complications. Your anemia is likely caused by a lack of iron and possibly vitamin B12 in your diet. To improve your condition, I recommend adding iron-rich foods like red meat, beans, nuts, and leafy greens, along with vitamin C sources like citrus fruits to help with absorption. Also include vitamin B12 sources such as eggs and dairy. Try to avoid tea and coffee with meals as they hinder iron absorption. Making these small dietary changes can significantly improve your health. Would you like some guidance on planning your meals? Thank you for sharing that. Based on your blood test results, you have, which means your body isn't producing enough healthy red blood cells to carry oxygen efficiently. This is why you've been experiencing shortness of breath and a fast heart rate. In the long run, untreated anemia can lead to serious complications like heart strain. Your condition is likely due to a lack of iron and possibly vitamin B12 in your diet. To improve this, I recommend including iron-rich foods like red meat, beans, nuts, and leafy greens, along with vitamin C sources such as citrus fruits to help with absorption. Additionally, foods like eggs and dairy can boost your vitamin B12 levels. Avoid having tea or coffee with meals, as they can interfere with iron absorption. Making these small dietary changes can help you feel better. Would you like some meal suggestions to get started? Anemia happens when your body doesn't have enough red blood cells to carry oxygen efficiently, making you feel tired, breathless, or even dizzy. This can be caused by a lack of essential nutrients like iron and vitamin B12. Over time, if left untreated, anemia can put extra strain on your heart, increasing the risk of serious complications. The good news is that with the right diet and care, anemia can be managed effectively. Let's discuss how you can improve your condition with simple lifestyle changes. To better understand your condition, let's talk about your diet. Can you share what you typically eat in a day? Do you include iron-rich foods like red meat, beans, or leafy greens? How about dairy products or eggs, which are great sources of vitamin B12? Also, do you usually drink tea or coffee with meals? These beverages can interfere with iron absorption, which might be affecting your nutrient levels. Your answers will help us find the best way to improve your diet and manage your anemia effectively. Your anemia is likely caused by a combination of low iron intake and a possible vitamin B12 deficiency. This means your body isn't producing enough healthy red blood cells to transport oxygen efficiently, leading to symptoms like fatigue, dizziness, and a fast heartbeat. The good news is that this can be managed with the right dietary changes and, if needed, supplements. By improving your nutrition, we can help restore your energy levels and prevent further complications. To help improve your anemia, I recommend adding more iron-rich foods like red meat, beans, nuts, and leafy greens to your diet. Pairing these with vitamin C sources such as strawberries, citrus fruits, and broccoli will boost iron absorption. Also, include foods rich in vitamin B12, like eggs, dairy products, or fortified foods, to support red blood cell production. One important tip, try to avoid tea or coffee with meals, as they can interfere with iron absorption. Making these simple changes can have a big impact on your health and energy levels. If dietary changes alone aren't enough, we may need to consider iron and B12 supplements to help restore your levels. Including iron-fortified cereals and vitamin B12 fortified foods can also be beneficial. To manage symptoms like dizziness and fatigue, try eating small, frequent meals throughout the day. Staying hydrated and getting plenty of rest will also support your recovery. With these simple steps, you'll start feeling more energized and healthier soon. We'll check your hemoglobin levels again in 2 weeks to see how well your body is responding to these changes. If your symptoms persist, we may need to run additional tests or adjust your treatment plan. Remember, I'm here to support you, so if you have any concerns or questions, feel free to ask. Your health is our priority, and with the right steps, you'll be on your way to feeling better soon. That's it for today's OET speaking practice. I hope this role play helped you understand how to explain anemia clearly and effectively.